Good day, everyone. Welcome to Smart Spark Academy. If this is the first time you're coming across our video, please like, comment, and subscribe so that you keep seeing us on your page. Now, today we'll be looking at osteology of the scapula. This is from anatomy babies. We'll be looking at the scapula as a bone, description, the muscles passing through each parts, the parts of the scapula and all that. If that's what you're looking for, please sit back, get your notes and your pen as we learn together. Now, this is the scapula. Take a very good look at it. Now, this is the left scapula. As we progress, I'll teach you how to identify and know which scapula is left or right. Now, as we all know, anatomy have the anterior surface, posterior surface, medial surface, and lateral surface. Anything we are talking about in anatomy, we should remember anterior, posterior, lateral, and medial. Now, this is the anterior surface of our scapula. So I can look at it. As you can see, sorry, it's smooth. This is the posterior, the back. Don't forget that anterior is the front, posterior is the back. If you notice, the back have a spine. We'll talk about all this. Now, this is the medial surface, actually a border, medial border, and this is the lateral angle. So let's proceed. Description of the scapula. Now, let's describe the scapula. We'll also take note of the shape. The scapula is a flat, look at it, it's flat. It's a flat triangular shaped bone. It's very obvious. If you don't remember anything, anytime you see, you have to identify a bone, and you see any bone that is in shape of a triangle, the first thing that should come to your mind is the scapula. That is a flat triangular shaped bone. Now, it is also known as shoulder blade. Okay, the scapula is also known as the shoulder blade because the spine and borders are easily palpable. Now, you can easily see the scapula at your back, at the lateral region of your back. It's very obvious in slim people. If you try to push against the wall, you notice something like a bone bulging. Now, that bone is the scapula or the shoulder blade. If you don't remember scapula, remember shoulder blade. Now, that's that on the description of the scapula. We have some important things we should note in this scapula. Scapula have angles and it has borders. It has three angles and it has three borders. We'll talk about that shortly. Now, as you can see, the scapula has three angles, three borders, and two surfaces. I want you to note 3, 3, 2. Three angles, three borders, and two surfaces. Now, it has the superior angle, inferior angle, and lateral angle. Let's talk about each of them. Now, looking at this, remember I said this is the anterior process of the scapula. This is the front. Now, this is the superior angle. I also remember telling you that the scapula is a triangular bone. So let's draw a triangle. This place now is an angle. This is an angle, and this is an angle. Let's relate it to this, and this. I believe you can see it. Now, this is the superior angle. This is the inferior angle. The angle down is the inferior angle. And this is the lateral angle. Now, the superior angle is where the superior border and the medial border meet. The inferior angle is where the medial border and the inferior border meet. Now, this lateral angle, which is here, see here is the lateral angle, is also known as the glenoid process. You see this place that's looking like a cup. It is an attachment, serves as an attachment to another bone in the body. It's called the glenoid process. Look at it. Lateral angle or glenoid process. We'll talk about this glenoid process very well. Now let's move to the three borders. I said that scapula has three borders. Now this is one border, two, and three. 1, 2, 3. This is the superior border. This is the medial border, and this is the inferior border. Superior up. Medial. Remember, I want you to remember that in anatomy, medial is the part closest to the middle of the body, the midline of the body. This is the mid is closer to the midline. This is medial border, and this is the inferior. Inferior is down, superior is up. Inferior border. Now, the inferior border is the thinnest border. If you look closely, if you're privileged to see a scapular bone, you notice that this border is very thin. Now, these are important things to note if you're asked to write on the scapular bone in your exams. These points I'm giving you are very important. And also, it has a notch. Now, if this is the scapula, there is something like an opening here. The superior border has an opening which we call the suprascapular notch. You see this opening? It's called the suprascapular notch. I believe you're with me. The superior border have an opening which is the suprascapular notch. Now, through this suprascapular notch, vessels pass through it. I want you to note that vessels pass through the suprascapular notch. Now that's that on the superior border. I don't think there's any notable thing on this medial border and inferior border. So we go to the next, which are the two surfaces. I remember saying three angles, three borders, and two surfaces. Scapula have two surfaces: the anterior surface, front, and the posterior surface, back. If you look, the anterior surface is actually kind of simple, it's basic, we easily learn about it. Now the posterior surface, which is the back, is kind of complicated. It's not really complicated because that's why smart spark is here. We'll make it as easy as you can, so you can remember. Now the surfaces of the scapula is thin. It's very thin. You can literally see through it. You can see through it. It is thin and translucent. Now let's talk on the anterior surface. This anterior surface is also called the costal surface. Let me write it down. Very good. Now, the anterior surface is also called the costal surface. Now, it has something like a depression, a hole. Not really a hole, because if you say hole, that means you can put your finger through it. The way we can put our finger through this nut. That's something like a deepening, a depression. In anatomy, we call it depression. We have a depression which is called the subscapular fossa. We have the subscapular fossa, which is on the anterior surface. Now, this subscapular fossa, remember I mentioned that we'll talk about some muscles. Subscapular fossa have some muscles on it, which are the subscapularis muscles. I would also write it down. So that's just that on the anterior surface. Don't forget, it's also called costal surface. It has a depression called the subscapular fossa, and the subscapularis muscle pass through it. Now let's talk about the posterior surface. I wrote now. Let's look at the anatomy of the posterior surface. Remember, I said posterior is back. Now, if you look at the back, it has a spine, something that divides the scapula into two, the back of the scapula into two, up and down the spine. So one notable feature of this posterior surface is the presence of a spine. We call it spine of the scapula. Don't forget that this spine of scapula divides the scapula into two, up and down, but we cannot call it up and down literally. So we call this the suprascapular and infrascapular fossa. Shebi is fossa. Let me see that one again. Now, don't forget the spine of scapula. It is the most notable feature of this scapula, this spine. Now, we'll talk about the spine shortly. But I remember saying the spine divides the scapula into two, up and down. But in anatomy, we cannot call it up and down literally. So it is called about the two parts of this posterior surface, but I won't take much time on that. Now, the supraspinous fossa, as I said, is above the spine of the scapula and it's smaller, as you can see, it's obviously smaller. While the infraspinous fossa is below the spine of the scapula and it is much larger. Now, this fossa provide attachment for some muscles. We mention two good muscles, like two important muscles. We have the supraspinatus muscles and the infraspinatus muscle. So supraspinous fossa provide attachment for supraspinatus muscle Infraspinous fossa provide attachment for infraspinatus muscle. So with this, we are done with looking at the angles, borders, and surfaces of the scapula. You can just go through this. Now, there are still some important components of this bone that we'll look at. We'll be looking at the glenoid process. We can also call it the glenoid fossa and or the glenoid cavity. It all means the same thing. Now, when you hear a process, it means something attaches to it. Now, this glenoid process, it's the lateral angle. Look at it. This place here. This is the glenoid process. Now, it forms an attachment with the bone of the humerus. Now, this is where our glenoid process is. This is the bone of the humerus, the bone of the arm, the upper arm. Yes. Now, the bone of the humerus attaches to this place, which is called the glenoid process, and it forms a joint, which is known as the glenohumeral joint. Okay, please pardon my diagram. I just want to use this to explain. Now, this is the glenoid process of the scapula. Now it attaches with the head of the humerus to form what we call the glenohumeral joints. Now it's also known as the ball and socket joints. This is the ball, the head of the humerus, and this place, which is the glenoid process or glenoid fossa or glenoid cavity, anyone you call it, is known as the socket. So it forms the ball and socket joint or the glenohumeral joint. Now looking at this glenoid tubercle, you notice a supraglen, it has the up and down. Okay, let me start with this. It has the up and the down. This is the supraglenoid tubercle, while this is the infraglenoid tubercle. Now, the glenal cavity, it is relatively shallow and it is concave in form. It is shallow and it is concave in form. Now, let's talk on the supraglenoid cavity and the infraglenoid cavity. Now, the supraglenoid tubercle, it's located, I think I should write it down. Now, the supraglenoid tubercle and the infraglenoid tubercle, look at it, supra up, infra down. The supraglenoid tubercle is located superior, just above the glenoid cavity. As you can see, it is up. It is just above this cavity. Now, it provides the proximal attachment of a muscle, which is the bicep brachii muscle. Please don't forget this, it's very important. Now, this bicep brachii muscle have its proximal attachments here. Then the infraglenoid is just below or is inferior to the glenoid cavity and it provides attachment to the tricep brachii muscle. So supraglenoid bicep brachii and infraglenoid tricep brachii. And that's all on the glenoid process or the glenoid cavity. Let's move to the next, which is the coracoid process. We'll look at the coracoid process now. Now, before we talk about this coracoid process, I want you to note that these attachments that the glenoid process have are for the long head. So, supraglenoid tubercle, long head of bicep brachii, infraglenoid tubercle, long head of tricep brachii, all long heads. Please note. Now, to the next, which is the coracoid process. The coracoid process is this arrow is this big shaped structure on the scapula. We find it su- anteriorly, sorry. Look at it. This big shaped structure is called the coracoid process. It is big shaped, it is hooked shape. Anyone you can easily remember it as. That's the coracoid process. Now it serves as attachment to some important muscles of the upper limb. Serves as attachment to the short head of the bicep brachii, the pectoralis major, pectoralis minor, and the coracobrachialis muscle. These muscles attach to the coracoid brachii. We have the short head of the bicep brachii, the coracobrachialis muscle, and the pectoralis minor muscles. Now, if you're writing your exam, please note all these muscles, state them out. Now, these muscles attach to the coracoid process. Don't forget that the glenoid process, see, if you notice they are close, this glenoid process here, which is the supraglenoid tubercle, has the long head of the bicep brachii. Here, which is the infraglenoid tubercle, have the long head of the tricep brachii. While here now, which is the coracoid process, has short head of bicep brachii, coracobrachialis, and pectoralis minor. Now we'll go to the last one, which is the acromion of the scapula. The acromion, the spine of the scapula, we'll talk about it soon, terminates at this apex. Now this apex is known as the acromion. Now, the acromion is very important. It helps in the positioning of the scapula in the body, and it articulates or joins with the clavicle. It forms a joint with the clavicle, which is the acromioclavicular joint. Now, the clavicle is the collarbone, the bone of the collar. It forms a joint there, which is the acromioclavicular joint. I think that's the most important thing to note about this acromion. Now, let's look at the spine of the clavicle. The spine of the scapula, sorry. Now, we've already talked about this spine. I just want to mention the two muscles that attaches to this spine. Let me go first. No, sorry. Yeah, deltoid and trapezius. Now, we've already talked about the spine of the scapula that divides the posterior surface into two. I want you to know that two important muscles attached to this spine, which is the deltoid muscle, and we have the trapezoid muscle. Please don't forget. And don't forget that this spine of the scapula terminates at its apex, which is known as the acromion. So these two are related. Now, we're almost at the end of today's lecture. So please, if you still haven't given us a thumb up or a like, please do so. And don't forget to subscribe to Smart Spark Academy and drop your comment. If you have any question, feel free to ask. And Smart Spark is always ready to reply. Now, I want us to note the joints of this scapula, because a very important question that comes out in exams. Now, what joints do this bone, the scapula, form? The first one is the glenohumeral joint. We've talked about it already. The joint it forms with the humerus, the bone of the hand. That's the first joint. The second one is the acromioclavicular joint. This is joint it forms with the clavicle. The glenoid process forms with the humerus. The acromion forms with the clavicle. It's from the name you even know what it means. And then the last one is the scapulothoracic joint. The scapula forms a joint with the thorax. This place, this subscapularis fossa, subscapular fossa, sorry, it forms a joint. It attaches with the thorax through the scapulothoracic joint. You know that the thorax is like the body. So those are the three joints. So if you ask what attachments does the scapula have, like what bones does the scapula attach with? Don't forget humerus, humeral, clavicular, clavicle, thoracic, thorax. That's a giveaway question. Thank you very much for watching to the end. Keep watching Smart Spark Academy.